Well, we're coming now to two items which I like very much. I consider that we have doctors who are giving us medicines, and they will help us in overcome our problems. But there are many things where I consider that we as person, we can do a lot of things for ourselves. We cannot just expect that a PhD or a physician, but he settles all our problems. It's impossible. MPNs is very complex. We have a lot of symptoms, but we do not have an exclusive symptoms. So a symptom which we have can be also for different things. And so I have the next two things which are coming up, they're all related to this. One thing is that if you have a big cancer, breast cancer, prostata cancer, whatever it is, you have places in the hospital where you can go in between the visit of your doctors. You can have a phone call, you can call the nurse and you can say, listen, I have that and that problem, can you help me, etc. Or you want to have a test earlier, etc. If you don't have that service, you cannot get the doctor. You all know, when you normally want to contact your hematologist, there's no way you can. You have a meeting within 3 months, and that's when you have to go and, you have to write down all the things which has happened to you, which we are also working on, but it is helping more. But I simply said, it doesn't make sense that I continue to complain to the authorities and says, listen, our social security system is not working because it's not giving us the possibility that a patient, like any other big cancer, he can go as an opinion or he can relieve him by the problem. Why can we not get that being a small illness? And we only cannot get it because we have a small illness. So, when you realize that, you cannot expect, sorry, you cannot expect that from the state, you have to try to find solutions. And it started in the States. It's the nurse navigating system, which you have a nurse who is established, who works in the, let's say, in the MPN group. She gets a phone and she gets in contact with a patient. She talks to the patient after the meeting. She helps him to arrange all the tests which he has to be done, etc. And so we decided as our foundation to finance a trial in Hospital del Mar, where I have a lot of contacts. I'm very often there. My physician is there. And I suggested them, I disagree strongly, but only because we have a rare disease, we do not have the same service as a person who has a breast cancer. This is not fair. I mean, it should be for everybody the same thing. So we have made this trial, and I'm happy we have today 3 people, from a hospital, and they will explain us a little bit how we are doing that, yeah? She is the nurse, Gabriela. She is hired by the foundation, and she works in the hospital. Sind ihr dagegen? Ein Mikrofon, ist da? Vamos, te lo pondrán aquí. It will be in Spanish, so you better put your earphones on, yeah.
Hola, hola. Vale, pues esto.
Vale.
Bueno, aquí. Hola. Y gracias al...
No translation?
Okay.
Ingrid, no translation? ¿Qué?
Hay mando para pasar a diapositivas. No, no.
Había.
Aquí.
Tienes que apuntarlo ahí.
¿A dónde? Aquí.
Sí, creo que sí.
A ver, avísame.
¿Ya estamos?
Tienes que apuntar a la cámara.
A la cámara esta para hacer el... para avanzar.
Eso es.
Listo. A ver.
Bueno, empiezo otra vez.
Si no me lo dices, y yo te lo estoy pasando.
No va.
This is otro
Okay.
slide.
Okay.
Okay, hi, good afternoon. Thanks to Peter and the foundation for inviting me. And thanks to the hospital and the hematology team to make it possible my participation as a nurse navigation. My name is Gabriela Aguirre, and I joined the team 9 months ago. And I'm at the Hospital del Mar as a nurse navigation in the external consulting. At first, I didn't know well what it would consist, my role. And nowadays, I have not enough hours of the day because I have a lot of work. There's a lot of patients and there's a lot of work to do. And I mean, that's actually good. So next. Well, I want to talk briefly about the role of nursing, about my function and how we work to guarantee constant attention for patients. And the principal objective of it's to have a continuous attention with no interruption, and it's based on their needs, avoiding and making it easier the company during all the process. Another purpose is to the advance of treatment, making the patient powerful to improve their quality of life, and that the management of cases is not only about the processes, but also humanize the attention and looking for the company of the people on their path with the illness. So the role as manager consists in coordinate the attention of the patient with the purpose of making sure the attention and the constant attention and making a clinical following with the symptoms to contribute the checkup of their health stage, bringing education and support to make a reference for the patient and their family, to solve questions in the process or any doubts they have, and to bring emotional support and psychological support to be able to. And so we are able to get this. We are with the team that includes hematologists, nurses, biologists, technicals, pharmaceuticals, all the team, the professional team, including the administration personnel, that make sure that the assistance process continues. The next one. So in the care coordination is based on to be a link between the patient and the doctor outside of the consult and in other areas. And the coordination of diagnostic tests, where we have a lot of work. It includes the medical test and verifying that it's done before the next doctor appointment scheduling, and the management, and that we have the consents to be able to do the test, like the biopsy and things like that, that are scheduled at the hospital. And the management of interconsultations, that the maintenance appointments and the trials and the analysis. I also have to reprogram them in case they are not done or when they don't come constantly to the appointments. In hematologies with other specialists, I see if they are done and the reprogrammation in case they don't go. The next one. The role of the nurse is a coordination, like a whole coordination where the assistance to the patient is included, not only the ones that are diagnosed, but also the ones that are in the study with polyglobia, with thrombocytosis, etc. And I have to intervene to contribute that the early detection of MPNs. My role is the conduction, the link that with all of the steps that we have to follow in the first visit, in the diagnostic tests, the start of the treatment, and the follow-up visits during all the process. Next one. The clinical follow-up is almost, the 80% is on the doctor appointments, when we control vital signs, oximetry, and anthropometry. We also weight people, the blood draw, and MPN 10 symptom questionnaires. And with the formula MPN 10 to see symptoms of treatment resistance, to see how the illness is going, and the registration of the EHR before the appointment, and the incidence resolution as the programmation or doubts about the medication and symptoms that could appear during the illness. Apart from that, I also include that we collaborate with the monitoring of parameters, hematological parameters, to see if we need a transfusion or any other requirement with other fragile patients that come to the consult every week. Could you go back, please? To number 7. And catch up, follow-up lines. Forward, forward. Yeah, perfect. The 3 follow-up pathways. At first, since I'm in the doctor appointment and simultaneous with the doctor and the hematologist, the 60% are in person, the other 35% telephonic, and the other 5% per email, because there's only some patients who need it. The reasons for calls received, we register them so we can know what the cost is of the consulting. The 35% is the programming of the schedule, the appointments that they didn't have the letters, or other cases as patients that couldn't come to the appointment or that can't connect or communicate with the consult. The other 35% has to do with the treatments, interactions, and conservation of the medicines or side effects. And the 30% is about symptoms. It's the smallest proportion, but are the most interesting for us because they would need maybe to have an early appointment or additional tests. Next one. So education and patient support. We bring information about the disease and treatment, medication and self-administration, and education for self-administration in patients who need it, like interferon or anticlotine. The self-care and management of side effects. We showed them how to deal with it, and when the therapeutic line changes, identify improvements on quality of life and check in on healthy habits, and that could minimize the risks of complications. Next one. The emotional and psychosocial support. It's the last one, but it's not the least. And as a role of nurse, the idea is that we can bring people sources that can deal with emotional aspects that can improve people's quality of life. We offer an accompaniment in the diagnostic and therapeutic process that's personalized during all the history of the illness, detection of psychological or social needs that requires intervention of consults or with mental health, referral to social services or to Cancer Foundation to deal with helps and support, economical support, and manage cultural mediation with people who need maybe translators, making the communication easier and the access to the health in a multicultural environment like the hospital Elmar. And lifestyle assessment. We include the smoking behavior, weight management and healthy eating, and physical activity level and sedentary behavior. In myoproliferative illnesses, it's older than 60 years old, so the sedentary levels and overweight are very common. Smoking behavior, for example, or healthy eating habits, and the level of physical activity and sedentary lifestyle. So we can improve the physical activity and reduce the IMC and check up on lifestyle habits to reduce the risk factors. Next one. The MPN 10 symptom questionnaire, it was made 4 months ago, before or after the appointment, immediately to see symptoms like fatigue, early satiety, abdominal discomfort, inactivity, concentration problems, night sweats, itching, bone pain, fever, and weight loss. Through this questionnaire, we can see the symptoms that are present on the illness. It's a guided questionnaire, but is kind of hard that they can divide and see and detect symptoms that are not from other illnesses. These questionnaires, I always give them before or at the beginning of the treatment, in follow-up visits to see how it develops. And it also allows me identify frequent symptoms on patients at the beginning of the treatment and afterwards. In the 4 months that I have been with these questionnaires, we have 196 forms, that 45% are ET patients, the 36% are PV patients, and the 19% are MF patients. It's smaller, but I hope it gives a lot of data. In this graphic, we can see patients with thrombocythemia. We can see that the fatigue is the symptom that's most frequent, especially in women. And we can also see that the fatigue symptoms and cognitive alterations are most frequent, that have more symptoms that are more frequent on women. I wanted to focus on different symptoms depending on if it's a man or a woman, to see if it affects a lot. The next one, in PV, we can see that it's highlighted the concentration problems, but they can be modified, the data. Fatigue is also very frequent for both genders. The night sweats in women are very frequent. Anxiety is also very frequent, and they can also refer to other processes like menopause, that in this age burden can be hard to make the difference. And the next one. In myelofibrosis, fatigue is the most frequent symptom in both genders, and in men it's also highlights the concentration, the itchy skin, the belly pain, and the results men have more frequent symptoms, and women have more symptoms referred to bone pain and problems associated with the spleen, splenomegalia. Now the current contributions to facilitate spontaneous patient consultation, that it didn't exist until now: speed up care in consultation, have a professional reference available, raise awareness of the MPN Patients Association in Spain, promote activity of the associations, cancer associations and MPN association, provide support and give access to an MPN journal that's an app to catch up with the symptoms, provide support to patients and their family, and offer support to transplant candidate in collaboration with the hospital St. Paul. I was there at the hospital to know how the process was with the patients there to get a transplant, and with the idea to be able to make my contact bigger and to understand all the process with the patients. And future contributions: to have an information dossier available for diagnosis, identify areas for improvement in care, assess satisfaction with the quality of care received, identify risk factors, and analyze the impact of diagnostic, treatment, and possible disease evolution on mental health. That's something we have with Peter, an aspiration, and implement habit change strategies in collaboration with the CAP. With, for example, the program of stop smoking program, weight loss programs, healthy eating habits program, different programs that improve healthy lifestyle habits. And the conclusion: the case manager has a key role in monitoring patients with myeloproliferative neoplasms, contributes to the medical team optimizing both patients' experience and clinical outcomes. It has a role also in the efficiency and activity costs. There are studies that offer that the attention model can bring to and end up to quality and detection and reduce the number of appointments that they need. The impact in the inclusion of the nurse in the diagnosis and the follow-up of patients with MPNs, it improves the quality of the assistance. Next one. And thank you for your time and attention. I hope I brought something to the table, since it was a role that didn't exist until today. And my role is an essay of the function of case manager in MPNs. If there is any question. Thank you.
Bueno, muchas gracias, Gabi.
Thank you very much,
One
Gabi.
day, when she started the work, she didn't really know what she has to do. And so it was something completely new what she was doing. And, I also wanted to thank the hospital itself that they allowed me to do this trial. I mean, there are things which you cannot see really or you cannot bring it so declared. But the patient is so much relieved that he can talk to somebody outside of a doctor, if he has a problem, God knows, many things can happen. And he can talk to people, and which is such a big advantage for patients. I think this is very, very important. But this is a very expensive program. We can do that. We made a trial. We're financing it, but we do need the help from the pharma company or from simply anybody who can support a deal like this. Because I thought at the beginning this is a Spanish problem, but it's not. I mean, Germany told me that they would like to have it in France. In other places, they would like to have it. So it's something which, we should more globally look at it and try to find a solution to help patients this way. If a big cancer can give it, also for a small cancer, it should be possible. And, we have to help it. We have to work on it. Okay. Does anybody have a question to it? Please, 2, 3, 4.
Peter, you said it's expensive. I think it would.
I didn't get you.
No? Okay.
Yeah.
I was surprised to hear that you said it's more expensive than having a nurse, and I would think the opposite must be true. To have somebody who has probably more time, and as usually nurses are sadly underpaid in Germany, or usually not paid as well as doctors, I would think the system would be more cost efficient. Can you explain why you think it's more expensive?
Well, I didn't want to say that it's more expensive than a nurse. I didn't want to say that. What I say, it is an expensive attitude. It's expensive work which you have to do. If I have to employ for the MPN patients one nurse, I have to pay the salary, I have to pay the taxes, you pay something to the hospital, and then simply it is costing a lot of money. But, obviously a nurse, she is a nurse also. So I cannot compare with a normal nurse and a dedicated nurse to MPN. I think she's probably more effective as an MPN nurse. But it's an expensive exercise, let's put it this way.
But if the outcome is better, I mean, it's probably difficult to kind of measure the cost efficiency. But if you have a better outcome because people MPN patients live a healthier life because have more regular interchanges with people who tell them what is good for them, I could imagine that it is difficult to measure, but it's certainly beneficiary.
It is, yeah.
Okay.
And, this is now only for the last 6 months, when we started, the results which we are having. Now, I'm waiting for end of a year, or let's say in March, when it's 1 year that we have it, and then we will make an expensive report what has been improving. I also want to know the opinion from the patients, which we simply didn't have time to to really get to it. But I want to know from my patients, what do you see as an advantage on the whole thing? But, you will get a lot of data from the patients, data which are not, in a computer of a doctor, about the feeling. It's always the same question. You say, well, you're okay, your values are okay, but he doesn't ask how do you feel. And then very often you have a patient who is cured, not cured, but he is under control by medicines, but is feeling very bad for whatever reason it is. And this is coming out if she's going with this work to go on. So it's simply, it's costs money. It's imagine, I don't know how much in Spain, we have probably 20 hospitals where we could bring in. If you put that in 20 hospitals, but that costs you easily 50,000, 60,000 euros. And that money has to be made first.
But it's faster.
Yeah. That was the reason of it, yeah. Please.
Thank you. I am Christopher. I'm the head of the hematology department and the representative of the Hospital del Mar institution. And I wanted to say that we are very grateful and we thank very much the MPN Association because you have supported our patients with Gabriela care, and I think this is very good for our patients. And the final outcome, I think it's better because not only in terms of adherence and care and taking the treatment, but it's a matter of well-being for the patient. They feel companioned, and public system, at least in Spain, not always will have money to pay for it. So they prioritize, and they cannot afford for.
It just comes back. I don't accept that because it's a rare disease. We cannot have that help. It's not fair.
But at least at our hospital, even for frequent diseases, we have shortage of nurses, referral nurses, giving this attention that Gabriela is giving to MPN patients. So in name of our patients, we are very grateful for your effort.
Yeah. But as I said, we talk about Germany. Germany also, it's underpaid, you have the same problem. And I talked to people from Germany, and they said we would love to have a system also. So it's there. The demand is here now. We simply have to try to realize. But here again, we have to do it together. This cannot be done by just, let's say, one unity. This is why I brought you all together. I wanted to prepare, to offer you and to show you cases which we can realize and which are of a very big importance for our patients if we are going to work together. There.
Talking about the money, I think the benefits are at the patient side. That's proven. But the doctor, he has more time for more patients because he doesn't have any visits anymore in that frequency he had before because she already takes care of that consult.
Absolutely.
So there must be the profit money-wise for the hospital. The doctor, which is more expensive, can do more patients in the same time.
Explain it to the doctor, to the director in a hospital. Yeah.
Hi, so I have the pleasure to have 3 special nurses in my MPN team. Not only in the MPN team, we have every single hematology super specialty has special nurses in the UK. Leukemia, myeloma, sickle patients. So we all, even for iron infusions, we have a special nurse. So it's worth it the money, I can tell you that much. They do all of what Gabriela is doing, they do that. It's an amazing job for the patient. They are the extra. They do it I was telling my colleague, they even see patients by themselves. They can prescribe hydroxy, they can prescribe ruxolitinib. So, it is worth in the investment. And when I went there for the first time in 2013, I was like, we need to bring this to Spain. What are we doing? I mean, it's amazing. They do so much for the patients. They are there, as you mentioned, Gabriela, they call the patients after we give the whole speech, you have a new diagnosis, here is your treatment. They call them. They help with the appointments. They help with, I don't know if I can apply for extra support from the government. Can you help me? They, like, honestly, the whole way. And they also receive a lot of positive things from the patients. They always have cakes on Christmas, you know, so it's quite nice. But it is worth the money. And one of our special nurses, he has a massive work in fatigue with patients. So they run a program, all you say, talking with the GPs. Honestly, I can tell you from a clinician perspective, I will not do my job without the nurses. That's how it is. So I think you need to talk with the government. Honestly, it's worth the money.
I take you with me, yeah?
Yeah, you can take with you, absolutely.
Yeah, I'd just like to bring in my own experience from the Netherlands. We've seen some hospitals where we're doing exactly the same thing. I meet my hematologist once, and the next time I will go to her, and it switches over and over. She takes twice as much time as my hematologist. And because she's cheaper, I mean, it's like that. And the results in the Netherlands are absolutely very, very good. So I think financing should not be the problem here. This is really effective. And we should call it the Gabriela treatment. Yeah?
John, I think you can take over. Yeah? Thank you very much, Gabriela. Yeah, thank you.